Let's be prompt. Now let's get started. So I just want to thank everyone for joining. I see so many people joining the Zoom tonight, and I'm just so excited to kick off Healthcare Awareness Month with this incredible panel who I'm about to introduce. So just some information. So today is August 2nd, and all August long is Healthcare Awareness Month. So please follow at Healthcare Month on Twitter and Instagram, and follow and use the hashtag Healthcare Awareness Month all month long, including today while you watch the panel and after the panel, to let everyone know what you're learning, and also to learn about upcoming events and panels that will be holding all month long. So before we get started, I just want to thank the co-founders of Healthcare Awareness Month, one of whom is a panelist tonight, Peter Morley. He is a co-founder alongside Rachel Brody, another co-founder of Healthcare Awareness Month. They came up with the idea for Healthcare Awareness Month. It feels like only a couple of days ago, but probably within the last month. And I am just amazed by how quickly everything came together. And it's really a testament to their hard work, and also just the importance of this topic and the interest across the country about healthcare and awareness around it. And I can't think of a better panel to kick off this topic than Advocacy 101. And that's what we're here to talk about tonight. And just my name, in case I didn't mention it, is Sari Beth Rosenberg, and I am so honored to be the Director of Education for Healthcare Awareness Month. And this is the first of 4 panels that we'll be having alongside other educational sessions. So I'm going to be moderating the panel, and before we hear from our panelists, I want to briefly introduce them, but I really want them to tell their story. So I'm going to just do a brief introduction for formality's sake, and then we're going to hear from our guests because their stories of advocacy are so inspiring, and they inspire me, and I know they will inspire everybody watching tonight. So our panelists are, let's start with our first panelist. It's Ola Ojewumi, now I'm mispronouncing it. Ola, I'm just going to say it, even though we just went over the pronunciation. Ola is an activist and community organizer born and raised in Prince George's County, Maryland. As a student, she founded 2 nonprofits. One of them was Sacred Hearts Children's Transplant Foundation, and the other is Project Ascend. Ola initiated these charitable efforts because after she received a life-saving heart-kidney transplant, and this inspired her to give back to her community, and we're going to hear more about that in a few minutes. We also have Paul Gibbs. He's an independent filmmaker and healthcare advocate from Utah. He has dedicated the last 7+ years to protecting our healthcare and expanding Medicaid and other programs so others can have the life-saving access to care that he received. And I can't wait to hear more about that from him. We also have Mina Schultz. She is a healthcare advocate and cancer survivor with many, many years of experience fighting off the near constant attacks on the Affordable Care Act, as well as advocating for improvements to expand Americans' access to care. We also have Dr. Mina, who is an assistant professor of medicine and epidemiology at the University of Pennsylvania Perelman School of Medicine, and she's also a senior scholar in the Center for Clinical Epidemiology and Biostatistics at UPenn as well, and I can't wait to hear from her. And last but definitely not least, co-founder of Healthcare Awareness Month, Peter Morley, alongside Angelica, who maybe share some insights tonight as well. Peter Morley is a disabled patient advocate, a 2-time cancer survivor, and a healthcare activist who lives with chronic illness and lupus. He has advocated for increased healthcare access with elected officials and has testified before 3 different U.S. House of Representatives committees, as have other people on this panel. But I don't want to take away their stories. I think it's best to hear from our participants. So we're going to hear briefly the stories in the order that I introduced everyone. We're going to hear from Ola, Paul, Mina, Dr. Mina, and then Peter. I'll remind them of the order as we go. And then I have some questions for them. So without further ado, let's get started because I don't know about you. I want to hear from everyone as quickly as possible. So Ola, we'd all love to hear your story. I mentioned it briefly, but tell us the story of how you became such an inspiring healthcare advocate and activist.
Thank you so much for that lovely introduction. I'll just give a little bit of my story and explain how advocacy became my life and how I benefited from the Affordable Care Act. And I'll start off by starting from childhood. I grew up, one thing about disability and health issues is that it is a club that you can join at any point in time in your life. I grew up a normal, average, healthy kid up until the age of 9. I passed out at a school, after school camp, and my teachers and the counselors pressed my parents to figure out what was going on with me. They're like, she's not keeping up with the other kids. She's a little bit slow. Come to find out, I had an underlying medical condition called hypertrophic cardiomyopathy. This condition you may commonly know if you watch the news and someone has suddenly passed out and died of an unknown heart condition. Typically, they've had hypertrophic cardiomyopathy. The only difference was I didn't die. And within 2 years, my health condition spiraled out of control. I experienced heart and kidney failure, and I was put on the organ transplant waiting list at age 11. Close to age 12, I received a life-saving heart and kidney transplant, but I wasn't out of the woods yet. As a result of my organ transplants, I developed cancer at age 19. And without the Affordable Care Act, I wouldn't have been able to receive life-saving cancer treatment. I was able to stay on my parents' health insurance until I was 27 years old. And because of that, I started speaking out because there was a big push by the GOP to repeal the Affordable Care Act. I'll also say that it inspired me to become an advocate at a very young age because I was always facing discrimination and mistreatment within the school system. Despite having had a heart transplant, I still couldn't walk fast. I still couldn't walk up steps. I still struggled with my stamina, and my walking radius is about 2 blocks before I start getting tired and need to sit down. And I went to a 4th-floor high school, and we had an elevator, but I wasn't allowed to have an elevator key because students weren't allowed to use the elevator. So I would have to get on with a teacher, and even then they gave me dirty looks. I was even physically pushed out of the elevator by an administrator. And so push came to shove, and I learned how to advocate for myself by contacting a school board member and emailing them about the problem I'd been having. And that was my first taste of advocacy. I was like, I can produce social change by simply voicing my concerns and sharing my story. And then I became hooked. I wanted to become an advocate. I wanted to work in public policy. Years later, I would intern intern in the Obama White House. Very hard internship to get. At the time, the acceptance rate was that of Harvard Law School, but I was selected and I worked on the White House Council on Women and Girls for Gender Equality. But I took my experiences and I worked with different nonprofits, mainly Planned Parenthood, Families USA, and I got invited to speak on the Hill for different Save the Affordable Care Act rallies. I've spoken alongside powerhouses like Congresswoman Nancy Pelosi, Senator Cory Booker, and I spoke alongside Senator Bob Menendez, and one of my speeches went viral. It has 3.7 million views on Facebook. It was a Save the ACA speech alongside Senator Cory Booker and Senator Bob Menendez. So I shared my story with millions because the power of one voice matters. My medication, the medication I take, I know the movies and TV makes it look like when you have an organ transplant, things are fine afterwards. You no longer need medication. But the bitter reality is I'll be on medication for the rest of my life. My medication costs $2,000 for 30 days, and that's just one pill. The rest is thousands of dollars. And so I could not allow the Affordable Care Act to be repealed because millions of disabled people like me deserve equal access to healthcare, and without it, we will perish. So sharing my story taught me the power of one voice, and I'm so glad I was able to share my story with you all today.
Wow, that is so powerful. And I wanted to quote you the whole time, but one thing I just wrote in the chat, the power of one voice matters. And that's a big theme of tonight. And your story certainly highlights that. And thank you for also mentioning something that I think is often lost because of film and movies and TV shows, that the end of the story is always they get the organ transplant and happy ending, right? Fairy tale ending. So thank you so much for emphasizing that, because as the education director, that's something that we want to emphasize, right? That we educate everyone about the process. And that's why your voice is so important. So thank you so much. And I have more questions for you. Don't you worry. That's my little timer because I'm a teacher and I time things. So our next guest, then we're going to get to hear his story, is Paul Gibbs. And tell us your story, Paul.
Well, some of you may have noticed me nodding a lot through what Ola was saying about transplants and transplant medication, because I'm a kidney transplant recipient, so I totally relate to everything she's saying about the medications there. There are some aspects of our stories that are similar. Ola, your story was so moving. Thank you for sharing that. One difference is that I wasn't a normal, healthy kid ever. I was born with a kidney condition called bilateral ureteral reflux, which basically meant that the urine was going back up into the kidneys instead of where it was supposed to. And I had 9 kidney surgeries within the first couple of years of my life. I don't remember the surgeries, but I remember the trauma of it, if that makes sense. That's affected me my whole life. But it was long after that, in 2009, actually, no, it was in just the end of October, beginning of November 2008, kind of ironically, just weeks before President Obama was first elected, that I went to what was supposed to be a routine doctor appointment, at least I thought it was, just to meet my new doctor and get some medications renewed. And he told me that I needed a kidney transplant as soon as possible. So my life was completely turned upside down. At the time, I was working part-time. I was going to film school part-time. And I was also, the rest of my time mostly was spent taking care of my niece and nephew. I was living with my sister, helping her take care of them because she had to work full-time. None of those things gave me health insurance. I had no coverage whatsoever for a $79,000 surgery. And I needed another surgery. They decided my kidneys were bad enough that they were a potential risk to the new kidneys. So I had to have both of those removed. And as Ola's mentioned, if I did have insurance now, my medications would cost more per month than my mortgage payment. Fortunately, Medicare and Medicaid were there for me to pay for the surgery. Those programs, along with the friend who donated a kidney to me, saved my life. And I didn't feel I could just take what had been given to me and not give back. I so badly want everyone to have the access to healthcare that I had, to be there. So I got involved in my home state of Utah in the campaign to expand Medicaid here. You know, this is a very red state, so they didn't easily accept the Medicaid expansion of the ACA after it was ruled to be optional. So I got involved with that. Since I'm a filmmaker, I got involved by making films. I made a documentary about Medicaid expansion that got picked up by Think Progress, and that brought a lot of attention to it, really kind of reinvigorated the campaign at a time when we thought it was dead. And eventually we got Medicaid expansion through a ballot initiative. And I also spoke to one House committee along with Peter. Back in 2019, I was talking about my need for the protections for pre-existing conditions, but even more so to me, what mattered was my son's protections. And the pictures aren't showing up well here. The son you're seeing there is my son, Peter, who had an operation on his kidneys. He was 5 months old. He had an operation 1 week before I went there to DC. And without the ACA, he could be uninsurable for life. He's 2.5 now. Thankfully, he's healthy, but the problem seems to have been corrected. But I was there to stand up for him because I didn't want anybody left without access to healthcare. I definitely didn't want my little boy shut out because he had a problem he was born with because he was my son. I've probably gone longer than I should. I'll end there, but it just comes down to the fact that everyone has a right to stay alive. And that's what this is all about to me.
Thank you. Thank you so much, Paul. I'm holding back tears because I'm so inspired by you and so thankful. Thank you for sharing that story. And I'm so glad we're recording this so that many more can hear it as well who haven't already heard your story. Thank you so much. And I'll have more questions for you in a little bit. So inspiring. Thank you so much. Our next guest is Mina Schultz. Tell us your story, please.
Thanks, Sari. I can really relate to both Paul and Ola's stories. Healthcare just means the world to us, and I think it means the world to most people. My journey into advocacy was pretty unexpected. It happened in 2011 when it kind of fell into my lap. At that time, I was a graduate student. I was finishing up my degree and getting ready to start my Peace Corps service following graduation. My parents came to me around that time and said that there was this new law called the Affordable Care Act that would let me get on their insurance since I was under the age of 26, and that I could do that to cover myself between the time that my student insurance ended and my Peace Corps coverage would start. And I said, yeah, sure, whatever. I'm healthy. It hadn't even crossed my mind, health insurance. Like that was the last thing I was thinking about at all. And then in the last couple of weeks of school, my knee started hurting. I saw my doctor about it. He said, it's probably a running injury. You twisted it, just rest it and ice it and give it some time. And then, a few weeks after that, I walked across the stage to get my degree. I had my knee all wrapped up in an ace bandage, but I made it across. And then a couple weeks after that, I went right back to that doctor and said, nothing better. Let's do something. So he ordered an MRI, assuming that I had torn something and I might need surgery. And I got the results the next day, actually, which probably wasn't a good sign, but I didn't pick up on that. The doctor called, he said, Miss Schultz, I have some bad news. And, my immediate thought was like, okay, I'm going to have surgery. This is going to be a long process. And then he said, it appears you have a tumor, which was not something that had ever crossed my mind. I had never heard of bone cancer before, didn't know that was a thing. And I was in shock when I went to the experts. They told me what treatment was going to look like, what I had ahead of me. So from June 2011 through June 2012, I had 5 surgeries, one of which replaced my knee joint and most of the bone in my right leg. I've got a lot of titanium in me now. I received 27 doses of chemotherapy. Those were given inpatient, so I was in the hospital getting those. So in a good month, I spent maybe 2 weeks in the hospital, and that was a good month. And then in January, I came down with a pretty serious infection. I spent my birthday that year hooked up to oxygen and a morphine drip, but I made it through. Those last few months were probably the hardest physically and mentally, but I got to the end. And, now I'm really grateful. This is my 10 years cancer-free this year. I just had my scans a couple months ago. But, all of that treatment didn't come without a cost. My kidneys are damaged by the chemo drugs. My hearing was damaged due to the chemo drugs. Didn't know that was a thing either beforehand. My heart is going to be monitored for the rest of my life because chemo can cause heart problems, even decades down the road. So, and besides those physical scars, my cancer experience traumatized me. I have severe anxiety, panic in medical situations. And so for all those reasons, of course, I need continuing care. Then following treatment, I moved to West Virginia to live with my mom while I was getting back on my feet. And during that time, I kind of reflected on, the importance of healthcare and having health coverage. If I hadn't had my parents' insurance, I wouldn't have gotten that MRI because I wouldn't have been able to afford it. Like I would have just skipped it and kept wearing my ACE bandage and icing. And I mean, the care that I got over the course of that year was, hundreds of thousands of dollars worth of medical care. And it didn't bankrupt me or my family. So, I recognize that millions of Americans don't have access to that. They just go bankrupt or die when they don't have health coverage and they don't have the protections that the ACA put in place. So I wanted to do my part, as small as it was. I got a job helping people enroll in health coverage through the ACA and helping them understand their coverage, how to use it to access healthcare. And during that time, I learned that a lot of West Virginians didn't really know what the Affordable Care Act was. They just knew that they didn't like Obamacare. So during those years, I spent a lot of time, educating people on the facts, helping them realize the benefits that they now had thanks to the law. And I also got my health insurance through the ACA marketplace at that time, ironically. So I was helping people sign up and I had it on my own. And it was good insurance. It covered all of my lab work, my scans, medications. I, didn't have to worry that I was going to be dropped or charged more because of all of my conditions. And then in 2017, things changed. We had a new president, a new Congress, the repeal and replace fight got all fired up. An attack after attack came. I watched in absolute horror as my own members of Congress stood up and said that I should lose my access to healthcare. So I started writing letters. I had never shared my story before, but I thought if I could put a face to the protections that they were actively trying to strip away from me, maybe I would break through. And that wasn't just for me, but it was for all of my community members that I had met, had heard from. They shared their stories with me about how healthcare was so important to them. So, of course, I received, tons of form letters back, blah, 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 we're protecting healthcare, all of that. But at some point, one of those letters got to the hands of the media. And suddenly I was being asked by state, national, international media to share my story on a grander scale. And I did. And I didn't really think twice about it. It was important. I wasn't hearing enough in the press about the consequences for people like me if all of this repeal and replace stuff was going to happen. So I decided I was going to be the one to do it. I did interviews, spoke at events, organized rallies, talked to all of my members of Congress several times. I think I did a commercial at one point. Anything I could do to make sure that people heard me and that millions of other people like me would die if this actually took place. So, we were successful then. We have had triumphs with the last election, the Supreme Court ruling recently, but we're still a long way from having an affordable, accessible, equitable healthcare system. So advocacy isn't just about standing up and fighting when we're under attack, it's for moving us forward also. And there are plenty of actions Congress can take to improve life for the millions of us who depend on our healthcare. So they just need to keep hearing from us over and over and over again until it's done.
Thank you so much, Mina. And I have so many follow-up questions for you. And so I want to get back to you because we want to get some advice from you about how to engage with Congress people. So I'm going to get back to you, but thank you. So many people are writing in the chat, amazing, and how inspiring you are. And I think your story that you wouldn't have even found out what was wrong with you if you didn't have health insurance. And that is just horrific. And I'm so thankful that you had insurance through your parents and then went on to make sure that so many others do. And you're right, the fight's not over. We must move forward. So thank you. So our next guest, I'm going to just introduce Dr. Mina and let her tell her story.
Thank you. Thank you so much. I really am honored to be on a panel with everyone here. So I think my story in some ways parallels a lot of other people's, but I also think I kind of came into the Affordable Care Act or lack thereof, because I actually come into it with a very interesting perspective as being a patient with a pre-existing condition before the Affordable Care Act, and then up becoming a provider for patients with pre-existing conditions. So I was actually diagnosed before the PPACA. I was in medical school, and almost literally overnight went from someone who had qualified for the New York City Marathon to being so sick that by the January of my first year of medical school, so 6 months into it, I was blind in one eye, could not walk, was being fed through a tube in my chest, needed at least a dozen blood transfusions, and weighed less than 90 pounds. I was obviously hospitalized and bedbound. The medical school was amazing. And they immediately gave me a leave of absence because I was ultimately hospitalized for nearly 2 months continuously. However, the insurance company said, well, you're no longer a student because you're on a leave of absence. So they dropped me from my parents' health insurance. So then the med school reinstated me as a student, but the insurance company said I now had a pre-existing condition. I had maxed out my coverage for my care. It was already maybe mid-January, beginning of February. My insurance cost more because I had this pre-existing condition now. Debt collectors were calling while I was bedbound and sick. My parents tried to keep as much of it away from me as possible. I mean, like any parent, their primary concern was me. But I knew I was a burden, and I felt worse for the stress that I was causing them and the medical bills that I knew were accumulating. So I pushed myself to immediately get a job as soon as I could walk again. It was a seated job because I couldn't walk for that long. And so I could help pay off some of the bills. Then I returned to medical school as soon as I possibly could, because I needed the student health insurance now. But the student health insurance had caps on care, which I exceeded within 3 months, limited me to only seeing 3 doctor visits a year total. I had multiple complications and obviously needed to see more. I was actually in the MD PhD program. I dropped out of the PhD and I said, you know, I just need to get a job. I need to complete my MD degree so I can get some real insurance. Now, during this time, I was actually lucky in 2 ways. The first was I was a medical student. So the medical community banded around me to mitigate the situation as much as possible. But during this time, I actually saw this group called Doctors for America, and they were a band of doctors who literally rented a bus and were traveling from state to state and often to Washington, D.C., speaking up for this thing called the Affordable Care Act. And I remember reading it and listening to them and seeing what they were doing, sort of following their progress and feeling like nearly crying from relief that someone was speaking up for me, and just feeling this incredible relief that maybe things would change. My patients ended up having faced a lot of the same issues I did. They all have a chronic, incurable, pre-existing condition. Most of them are diagnosed very young. They need chronic medications that cost thousands a year. All of them need to see, like me alone, at least every 6 months, and often they're seeing other specialists. They need procedures and scans and lab work and a lot of lab work, and many need special home assistance or other accommodations. And before the Affordable Care Act, they would just suddenly stop seeing me. And I would not see them again until the next time when I met them in the emergency room. And I'd found out that they lost their insurance. So I started advocating for my patients. And, you know, I started a little bit later than I probably should have, but I was busy finishing my MD and then my PhD. And I believe that a government in a country as great as America would always stand up for the Affordable Care Act and try and make it better, not repeal it. Because it's not perfect, but it covers a lot of really important things. I mean, a lot of hospitalizations and lab work and medications and emergency services that would have literally changed my life if it had been around when I got sick. But like I think everybody on the panel has said, around 2017, I realized the Affordable Care Act was in big trouble. So I, someone who really hates public speaking, flew home to a radio station in Omaha, Nebraska, in my hometown, spoke about how important it was, started speaking up more, calling in weekly, answering questions, helping folks get enrolled. Mina's helped me a lot. Speaking up on social media, calling my senators, calling my representatives to tell them that me, a doctor, thinks this is a pretty big, important deal, not just for me personally, but for every single patient I see. And I've started going to Congress more. I've gone several times on behalf of the Crohn's and Colitis Foundation, advocating for changes that I know will help take care of my patients, because I remember how it felt when I saw doctors who were standing up for me. And I can't take care of my patients if they can't come see me. And my oath doesn't extend just to the people who can come see me in my own clinic. It really extends to all patients across the United States. And I think that this is a really important thing. I mean, I feel like it's absolutely wonderful that patients are standing up, but I think that the healthcare professionals and physicians and we are all tired, granted, with the pandemic, but frontline workers, nurses, everybody else should also be standing up, because our responsibility doesn't end with the patients we just see in the walls of our hospital or in the walls of our clinic. It really extends to every single patient who's out there. And it breaks my heart sometimes when I see folks who are really sick and still trying to advocate. They should be focusing on their health, and I should be taking that job, for them, just like there were a group of doctors who took over that job when I was really sick, and I was eternally grateful for it. So thank you very much.
Thank you so much, Dr. Meena. I think I speak for everyone right now. We're so overcome by emotion hearing your story alongside everyone else's. And I wanted to just emphasize something that Rebecca Wade just wrote in the chat, which I think I was also thinking the same thing. She just worded it perfectly. That emphasis on your oath extending to all patients, I'm like crying thinking about this, is so important. I love to hear physicians emphasize that. So thank you for emphasizing that tonight. Thank you. And I'll get back to you with some questions in a minute. But last but not least, we have, I hate that phrase actually, but our final panelist, and then we're going to do some questions, is Peter Morley.
Well, first of all, excuse me, it is quite an honor to be on this panel. These are all people that I've known and have advocated with at some point or one another. And it's such an honor to be here with all of you. Sometimes I feel very alone in this world when I'm in it's the middle of the night and I'm up, and I know that there are other people in this world that are doing such wonderful work, and it inspires me, and you all inspire me. And thank you for being here. I know a lot of you know my story, but I'm going to share it again because it cannot be said enough. In 2007, I was permanently disabled from an accident, and I was spared the costly medical bills of 4 spinal surgeries because I had continuous health coverage, as we all should as Americans. That's why I'm wearing this shirt. Healthcare is a human right. In 2011, I survived kidney cancer and fought my way into remission after losing part of my right kidney. In 2013, I was diagnosed with lupus, which causes me severe fatigue. I was actually diagnosed with a lupus flare today, so I know how horrible and horrendous a disease this is. Most days it's a struggle to get out of bed. I manage over 10 pre-existing conditions. I take 38 medications, and I self-inject myself with a weekly biologic injection, sorry. Used to be infusions. But most people like me with chronic diseases can live happy and productive lives, but only if we are provided access to health insurance that can't be taken away because an insurance company decides it's in their best interest not to cover something. Or if, like we've experienced for 4 years, Congress decides to repeal our insurance, like an administration like the Trump administration was going after the Affordable Care Act and then through the Supreme Court. But as someone who spends the majority of my waking hours in doctors' offices, I'm so sorry, excuse me, I need to recollect my thoughts here. I was actually a very private person before 2016. But once President Trump was elected and set to repeal the ACA, I can no longer be silent. And I decided to advocate for healthcare on Twitter. And with the help of my Congresswoman, Carol Maloney, she took up my cause of people like me. And in the last 4.5 years, I've traveled to DC 32 times. And I've shared the stories of thousands of people around the country who have reached out to me to share their stories and to tell me, please, Peter, please help me. And when somebody reaches out to you and says that to you, how can you say no? You can't. You can't say no. But my message to Congress and to anyone who feels that healthcare is not a human right is this. If you think pre-existing conditions are not important, just remember, someone you love can have an accident, be diagnosed with cancer or lupus like I was at any time, and that will change how you think about this. I know firsthand your health can change in an instant. I have always put my health at great risk to travel to Congress because I know that one voice, as Senator Patty Murray shared with me, one voice can make a difference and inspire a member, a legislator, a state legislator, anyone to change their minds. And I always push myself very hard because I never know if it's going to be the last time that I'm going to be able to do that. And people have shared with me over the years, because of all these healthcare repeal attacks, that they felt alone, afraid, and scared when they should be focusing their own energy on their own well-being. We all know someone who has been affected by a chronic condition, and no one should ever worry about their healthcare being taken away from them simply because they have become ill. I encourage you, as I do my followers on Twitter, to call your state and federal policymakers and share your personal healthcare journeys, because being proactive is empowering. I know it's not easy, because I am here before you today sharing the personal devastating details of my own life. But by sharing your healthcare journeys, you're putting a human face to what some people would be considered data. And we are not data. We are flesh and blood. So thank you very much for listening. And thank you all for being on this panel and for watching.
Thank you so much. And I think that's so important to emphasize that this is not data. These are human beings, each and every one of you on this panel, everyone listening tonight, everyone who will watch this recording, and everyone who's not watching this recording, right? Healthcare is not partisan. It's a human issue. And that's why I'm so thankful for all of you for advocating and at times putting your own health at risk to do so for others. And it's just, as I wrote in the chat, I said to Colleen, I shouldn't have worn makeup tonight. I'm trying to hold back. And it's tears of just hearing the pain that you went through, but also appreciation. And so I had a series of questions for you, but I'm going to just ask one, and I'm going to put them all together into one question because I'm a teacher and I know how to turn 3 questions into one. Watch this. Okay. So I'm going to go back in the same order, and we might run like 5 minutes over. I hope that's okay, but your stories are too important to rush through. So my question for all of you, and I'm going to go back and start with Ola again. So the question is, what do you think is the best way to advocate? And if you can include in that in your response, what's the best way to engage with members of Congress? If that's something that you have done or have advice for our viewers tonight. So once again, what do you think is the best way to advocate? And if you are engaging with Congress people, members of Congress, what advice do you have for our viewers tonight? So I'll start with Ola, and I'll repeat the question again in case people forget as we go around.
I would say the best way to advocate for me is through social media. I feel like posting a video, tweeting, sharing your story on social media can get to more people than, say, giving a speech in front of 20, 30 odd people. I feel like social media gives you a level of influence and a level of power and a level of visibility that that's more influential. Also, writing your congressman, I think that's pretty impactful. They have people, legislative aides specifically tasked with corresponding with you. So it's important to reach the leaders at the top, whether it's via social media, whether it's via letter. So whatever you can do to make your voice heard, do it.
Thank you so much. It's really helpful. Let's go to, now I forgot the order from before. Paul.
Thank you. Well, as far as the best way to advocate, I don't think there's necessarily one best way for all situations, because these things vary. I started out with a local issue with Medicaid expansion, and there were a lot of different components to that. When you're dealing with things on a local level where you can showing up is so important. Going to meetings and getting engaged. Social media is also very important. Media is a huge part of how I've been involved, making multiple films on the subject. As far as engaging with Congress, for me, it comes down to two things, whether it's Congress or your local legislators. One, know what you're talking about. That is so important. You need to know some of the specifics about this, because some of these guys, and it's usually men, so that are really strongly against this and are difficult to deal with. At least the ones that I've frustrated me most are usually male. Some of them really know the ins and outs of ways to make it sound, ways to spin things. And if you don't know what you're talking about, they're going to make it, to spin it to make it sound like there's no, like this isn't really a problem. You need to know what you're talking about. You don't have to be anti-Slavic, but know some things about what you're talking about. The second thing is hard, really hard, but it's so important. Be respectful. That doesn't mean be deferential, doesn't mean anything like that. It just means don't be insulting, no matter how hard that is. Believe me, when I testified, Peter and I had to sit there and control our tempers with Jim Jordan talking for 5 minutes. We know how hard it is to be respectful. Being respectful doesn't, Jim Jordan told 5 minutes of untruths about the ACA, and I called out every single one of them in my testimony, but I didn't say Senator Jim Jordan, GYM Jordan, or throw any of those kinds of insults at him, because that's just going to get in the way. And you never know when somebody, occasionally, and this is particularly true for me in local stuff, you're going to find moderate Republicans who can be persuaded. And if you have been insulting, you've turned them off. And those moderate Republicans who can be persuaded are some of the most important allies you'll ever get. So again, I know it's, as much as anybody, it's hard, but control that temper and be respectful. Be honest but respectful.
That's incredible advice. It's a skill. So I really admire you and Peter and everyone who has had to put it into practice. I summarized it by saying, you said, know what you're talking about and use decorum. And I editorialized and said, even when they don't, right? And it's a true skill.
Yes.
But you're doing it for the greater good. And I appreciate you for doing that. Let's move on to Mina S. So yeah, basically what is the best way to advocate? And also if you want to include, since it's something that you do as well, advice for engaging with members of Congress, if you want to piggyback off of what Paul was sharing.
Sure, yeah, and I am going to piggyback off of Paul. I don't think there is a best way to advocate. I think it's whatever makes you comfortable. Even if it's just, there's a policy you don't like or you do like, call your member of Congress, that it matters. You may think that just saying, hi, my name is, I live in this zip code, please don't do this. They're listening, they're counting those, so it matters. Peter's been doing Twitter. A bunch of us have been doing in person. It's whatever you feel comfortable with. I like writing my thoughts down. It makes it a little clearer for me to get my ideas down. But it's whatever makes you feel best. As far as actually meeting with members, a couple of things, I think Paul touched on it, and I think Sari did too, but decorum and respect are super important, but also don't be intimidated by them. They work for you. So, of course, be respectful, share your ideas, but, tell them what you're there for. And of course, share your story. Share it far and wide if you're comfortable. If you're not, share it locally, share it with one person. I have friends who say that, their foot hurt and they went to the doctor to get it checked out because of what I went through. I changed the fact that someone went to the doctor when they didn't want to. So tell one person, tell your community, tell everyone. But yeah, it's a matter of what you're comfortable with. There are tons of ways to advocate.
Thank you. So what I'm hearing from everyone so far is it's not a one size fits all process. Do what feels right, do what feels comfortable. But when it comes from the heart and when you're telling your story, that's what matters. So thank you so much, Mina. Dr. Mina, what advice do you have for everyone about advocacy and reaching Congress people?
Well, coming at the end, I think everybody has covered almost all of the important things. I think, when we are taking especially new patients to DC to advocate, and it's their first time, I kind of echo something that Mina said, which is, remember, first of all, they work for you. All right. These people work for you. They are your senators, your representatives, your state legislatures. Don't be intimidated. Don't feel like they know more than you, because you know your story and your experiences better than they do. So tell your story honestly, but just remember, no one knows your experiences more than you do. And remind them, that they work not just for you, but for countless other people like you. You are a constituent. You are a representative of the people in their district, in their state. And I think sometimes, and I agree with how you advocate, I love social media, but there is a power to telling somebody your story in person that makes it very hard for them to ignore you, and asking them the questions directly and face to face, and then posting that on social media and sharing that experience. What was the answer that you got? Hold them accountable to all of the other constituents who weren't there to advocate for their own stories themselves. Because remember, for every time you stand up, there are countless other people who have the same experiences, the same fears, concerns, and worries, but can't speak up because they're too sick, or maybe they've never done it and they're too nervous. And you're not just going to be giving a voice to their concerns, but you're also going to inspire them that this is something that they can do. It's as simple as picking up the phone and making one phone call. It's as simple as making the appointment with my state legislators, talk to them about something that's going on. You can do this. It's little steps, but you can absolutely do this.
Thank you so much. And I wrote down, I like to take notes in the chat for myself and everyone. I really like your advice about that the in-person is really effective. And then using social media to share it with others. But the importance of telling your personal story in person is so effective, and that's something for us to remember. So thank you, Dr. Mina. Peter, advice for advocacy and engaging with members of Congress.
Well, let's see, where shall I start? Well, my advocacy my advice used to be to vote. That would be my first advice. And that is something that still can't be said enough. Vote, 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 vote. That definitely makes a huge difference. My second piece of advice is something that Mina has said and Dr. Mina has said. They work for you. They work for you. And don't let them intimidate you. And I know it's hard, but you know what the truth is? There's power in numbers. And there are more of us than there are of them. And I know it's not easy. And this is why I encourage everybody to share their story. If everybody shared their story, healthcare would be the #1 priority. So share your story, share your story, share your story. They can't ignore the stories. I've heard this in many legislative offices, just congressional offices, from many legislators. If there are 100 people that call, like even 100 people will change the priority of what they are making a priority. So you can, if you rally 100 people together to phone bank, that will move the healthcare from, like, let's say #5 to #1. So that is probably the most impactful piece of advice that I could give you. But I know it's hard. I know it's not easy. It's still not easy for me to share my story on days, but I'm talking right to you right now. Please share your story. It's so important. They need to hear it. I know it's hard, but I hope that we've inspired you to share your story.
Thank you so much, Peter. Share your stories. We're all writing that in the chat. They can't ignore the stories. And Colleen wrote, they will not ignore us. They will not destroy us. Yes, yes, and yes. So I just want to end with just a question that I can't ignore from, who is it? Someone in the Q&A. Rebecca Wade had a question, and I know we're a little over, but this is what we're going to do. We're going to do this really quickly. Rebecca, and I think this is really important for everyone watching, because this is tiring work. And if you are dealing with health issues, it's even more tiring. And she wants to know, how do you balance your self-care and your advocacy? So we're going to do this with one sentence from each of you, starting with Peter. One sentence of advice for how to balance self-care and advocating. Peter, we'll start with you.
Turn off everything, disengage, watch TV, play with your dog if you have one, play with your family members. Well, you know what I mean. It doesn't come out right. Just disconnect.
Okay, great. And Rebecca is so thankful that we're doing this. So thank you to our panelists for staying a little over, but I thought this was a really important way to end. So we're going to I'm going to make this random. Paul, self-care and advocacy, how do you balance it in one sentence?
Still working on it.
Thank you for your honesty. Thank you for your honesty. I appreciate that. Dr. Meena.
I am going to paraphrase a quote that I heard from Vivek Murthy. He said, when I am feeling my lowest and my worst and my least my least useful to society, I do something of service to others, and it reinstates my feeling that I have power and I have worth. And I think that sometimes I agree with everything. I don't have a good work-life balance. It's my mythical unicorn. But I think sometimes I have to remind myself that if I just do one thing, I answer one question, I send one email, I make one phone call, I'm going to feel like I made a difference that day. And that may be all I need.
Thank you. Be of service to others. Dr. Meena, thank you. Mina Schultz, in one sentence, how do you balance your advocacy and your self-care?
Take a break when you need to. We're on this together. Someone else will shoulder the load while you need to wait. You'll come back.
I love that. I need to write this all down. I'm glad we're recording it. Ola, in one sentence, advice for balancing advocacy and self-care.
Take a damn nap when you need to. Rest. You cannot function or be a good advocate if you aren't well rested and you aren't taking care of yourself.
I think that's the perfect way to end as we're getting towards sunset here on the East Coast. Take a damn nap if you need to. Carly's clapping. Rachel Brody wrote naps for healthcare. Everyone's thanking everyone for this. And on behalf of everyone watching and everyone who will watch later, thank you to our amazing panelists, Ola, Dr. Meena, Paul, and Peter, and to Demcast for producing this tonight. Thank you, Demcast. We couldn't be on this screen sharing this important message without you. And once again, I want to thank Peter Morley and Rachel Brody, the co-founders of Healthcare Awareness Month. You'll be hearing a lot from them and the entire team and all of our partners. So stay tuned. Please write about your experience and what you learned tonight using Healthcare Awareness Month as the hashtag. And if you're not already, I don't know why you're not, but please follow Healthcare Month on Twitter and Instagram. We'll be sharing clips from tonight and so much information with you about what this month has in store. So once again, thank you to everyone who attended. I'm getting messages all over the place saying that you inspired so many people tonight. And thank you for your time. And now let's take a piece of our own advice and unplug, do some self-care, and take a nap, or maybe just go to bed. Thank you so much, everyone. And we'll see you again very soon. Squirrel time, as Mike said.